Okay, hi guys. So I just want to do a little video today, just kind of looking at X-rays and MRI scans and give an example of how useful they can be in helping you work with back issues and why they're very important as kind of a first step in chronic lower back cases, and why I'd recommend that you'd have them done before you get any treatment, and kind of give you an example as to how they'd help you understand what you definitely shouldn't be doing in terms of your back pain. Okay, so first things first, it's always useful to kind of understand the differences between X-rays versus MRIs. So on here on the left, you can see we've got an X-ray here, and you can see we've got a real clear picture here of all the hard tissues. So basically the hard stuff, the bones in your body. But here, where we've got the discs in between your vertebrae and your back, kind of looks like they're floating air. We can't really see what's going on in there. We could kind of tell if there's a loss of height between one of these discs maybe, but we couldn't really see if there was a bulge or a tear or something going on that we need to be concerned with. And also down here, so this is your L5, L4, L3, L2, L1, but we've got L5 here, and where it meets S1, it's actually kind of occluded in the X-ray by your hip bones, so we can't actually see what's going on down there. And in these kind of lower three here, these are a lot of lumbar disc issues actually occur. So it's important that we can see all of the discs all the way through, and compare them to discs around them, and also see if we can see any bulges. So if we compare this on the right, here we have the MRI scan, and you can see here we've got far more detail in the soft tissue structures here. So these are your vertebrae, these are your discs here. This is your actual spinal cord coming down here, this nice white looking cylindrical feature. So when we look at the discs here, obviously, one of the dangerous things is if we see any bulges here that might start to impinge on the nerve in your back as it runs down, because obviously it's going to cause you problems, especially things like sciatica. But it's important, just the main thing really with these two is just to see the difference between the two and why you'd want to go down the route of having an MRI really if you've got chronic back pain, to kind of see the sort of state that the discs are in, and see what's going on in there in a bit more detail, certainly a lot more detail than what you get from an X-ray. Okay, so moving on. So disc bulges, we've got two MRIs here. Excuse the resolution on this one, this isn't too good. But here we've got a relatively healthy spine. There's something odd going up here. But for the most part, if you look at these discs here, we've got a nice clear white nucleus in your discs, in between your vertebral discs. Looks nice and tidy, no bulges. Obviously spinal cord here, there's nothing drastically impinging on it. Looks nice and clean. Whereas if we look on to the right side here, you can see for a start, the discs tend to be a little bit smaller. And also one of the key things to look for discs is definitely lost height, is that on the MRI scan, you'll notice that it's a lot darker in colour. We haven't got this nice clear white nucleus in the middle. It's kind of started to fade, because obviously as the nucleus has started to leak out, there's basically less water in there, so we're not going to get as clear a picture. So obviously when we look on this side, you can look on this outside edge of the discs compared to this one. You can just see how they're starting to bulge, especially this one here, and this one at the bottom here. So this is L5, this is S1, this is your sacrum here, this is your last lumbar vertebrae. You can see here this one's actually herniated, and it's actually starting to leak material from your disc, and it's starting to pinch and impact on the spinal nerve here. And this bulge here is as well. This one got a slight start to bulge as well. So you can see this back here, compared to this one, these discs are a lot more damaged, and what a lot of practitioners would call this, in general sense, like degenerative disc disease. But in actual fact, if we look at the disc, look at the damage that's occurring to it, and also the direction in which the bulges are coming out and the herniations coming out. That gives us a big clue as to why this back is in trouble compared to a healthier back. So if we look here, each of these two discs, you can see the bulge is coming out this way. On this one as well. So basically what that means is that with this spine here, at this end of the disc, there's going to be repeated compression. So as these two sides compress, it forces the nucleus in the disc out, and it ruptures through the layers in the disc, which is structured a bit like the layers in the onion, really. It kind of forces its way out from the material, and actually kind of snakes its way out until you get a bulge here. And then if it goes on for long enough, we actually start to get a proper herniation, which is what we've got here. And you can see, especially in this one here, there's quite a lot of disc fluid compared to this side that's actually leaked out, and you can see that it's impinging now on the spinal nerve. So looking at this, we can tell that, the force is going this way, the nucleus is looking out this way, so we know that this side of the spine here compresses, i.e. gets shortened, which in this case would mean that the spine is being compressed or flexed. So if you imagine like an arch coming in this way, we know this is what's causing this material here. So we know for this person, looking at the MRI scans, they give you a big hint as to what not to do for, the type of damage that you've got in your back. We know that if we gave them flexion-based exercises, this would actually make the disc damage worse. Obviously, prolong the healing period, if it did heal at all, is obviously going to put them at danger of far more impingement on this spinal nerve here. So we need to be very careful that we don't compress the disc anymore. So we need to give them, make them mindful of things like sitting, bending, possibly squat technique, and or even deadlift technique as well. If they do train, anything that compresses and rounds that lower spine is going to make this worse. So this is where it becomes a bit dangerous if you work with a therapist and they don't understand what this means in terms of movement and what not to do. So for therapists, they don't know what they're looking at when they look at this, and they don't understand what's caused this injury. There's a big danger that they could give you exercises or treatments that will make the problem worse. So what do I mean by that? In terms of this, also we need to not flex the spine, so not round it out anymore, and basically teach the patient, ways to spare the back, and then to try and keep it nice and straight, so we're not using up these discs anymore. So what were the things we definitely want to avoid to make this back any worse? This sort of stuff. So you can see here, my back's all rounded. This is what we call flexion, where you round your spine into like a C shape. So my lumbar spine's here. So obviously if that was my back and I've got bulges, if I'm doing all this sort of stuff, it's going to make the disc bulges worse and prevent them from healing and gristling and settling down. And also this sort of stretch here, you're on the floor, same idea, tucking your knees up again, rounding my lumbar spine down there again, which is going to make my problem worse. So a lot of people come in, they come and see me doing these kind of stretches because they say it makes it feel better. It might make it feel better because you're kind of stretching out tight muscles, and it makes you feel more mobile. Kind of short term it will feel good, but in terms of the long term, it's actually making your problem far worse. So in terms of what not to do, you don't want to do this sort of stuff. And fair enough, it may mean your back will feel a little bit tighter for a few days as it starts to settle down. But if you've already ruptured your discs, I really wouldn't take your chances, or wouldn't fancy your chances if you continue to do this kind of flexion here and wear them out even quicker. So this is why it's really important that we get the right sort of scans and put that together with your activity history, what you do for a living, how your sitting, standing postures, how you walk. All these things come into consideration, but those scans are the first step, and they really do tell you definitely what you should not be doing to try and fix your back. So if you're going to see a therapist or a coach to help you work on your back, if they haven't got scans to look at, or they don't send you to go and get some, and then just start kind of arbitrarily giving you exercises to do, you're in a dangerous position there that you could actually be making things worse. So make sure you get some scans done first, and hopefully it gives just a little bit of insight as to how important they are. Obviously there's lots of different types of disc damage and back problems that you can have, but that just gives you an idea of what to do when you've got bulges that are coming out towards the rear of your spine, that have been caused by flexion or compression due to flexion. You know you need to avoid these sort of exercises for sure.